Welcome to the Deep Dive. Today, we're going to be diving into a healthcare system that's been generating a lot of buzz.
Yeah.
The Kerala model.
It's pretty remarkable what they've accomplished.
It is. You know, all of you sent us a ton of articles about how this small state in India, Kerala, is achieving healthcare outcomes comparable to developed nations, even with, like, limited resources.
Yeah.
And let me tell you, the numbers are pretty mind-blowing.
Oh, yeah.
They have a life expectancy of 77 years.
That's a full 10 years higher than the Indian average.
Yeah.
And it rivals some developed nations.
Exactly. And they've got the lowest infant mortality rate in all of India.
It's impressive.
So what's the secret sauce?
Well, there's no magic bullet.
Right.
Kerala has been very deliberate in building a robust public health care infrastructure.
Okay.
They've got this incredible network of primary health centers in villages.
Okay.
Then taluk and district hospitals for more specialized care.
Uh-huh.
And finally, tertiary care hospitals in cities for the most complex cases.
So it's like a tiered system ensuring everyone has access to some level of care.
Precisely.
Okay.
And they haven't stopped there.
Right.
They've launched this ambitious initiative called the Arogya mission.
Yes, I read about that.
Yeah.
Tell us more.
Well, the Arogya mission is all about transforming those primary health centers into family health centers.
Okay.
They're equipped to handle a wider range of health issues,
Got it.
including chronic conditions like diabetes and hypertension, which are becoming a major concern globally.
It's interesting how they're thinking long term.
Yeah.
Not just addressing immediate health needs, but also tackling those lifestyle diseases that are on the rise. I see they've also had great success in controlling communicable diseases like malaria and tuberculosis.
That's right.
Their focus on prevention is remarkable. They've implemented widespread vaccination programs, early disease screening, and robust maternal and child health initiatives. They're not just waiting for people to get sick.
Yeah.
They're actively trying to keep them healthy.
It's a good model.
And it makes you wonder, why aren't more healthcare systems adopting this preventative approach?
I know.
It seems so logical.
Well, you'd think so, wouldn't you?
Right.
But shifting the focus from treatment to prevention requires a real commitment from policymakers and a change in mindset.
Okay.
Kerala shows us what's possible when prevention takes center stage.
Okay.
But this success story is facing a new challenge,
a
rapidly aging population.
Kerala has the highest proportion of elderly people in India, right?
Over 16%.
Oh, wow.
And this demographic shift brings a whole new set of healthcare needs.
Right.
While their achievement in increasing life expectancy is commendable, it also puts a strain on the system.
Yeah.
They need more geriatric care, palliative care, and even home health care services to meet the needs of this growing elderly population.
It's like their success in one area is creating new challenges. Yeah.
In another, it makes you realize how complex these systems are.
Absolutely.
And speaking of challenges, even with such a great public healthcare system, I imagine there's still a lot of demand.
Yeah.
Are the hospitals overcrowded?
You hit the nail on the head. That's the paradox of a successful system.
Yeah.
People want access to quality care.
Right.
And the government, hospitals, especially the major referral centers, are often overcrowded.
Yeah.
This can strain resources and impact the quality of care, creating a constant balancing act for the system.
That makes sense.
Yeah.
And while we're talking about access, what about the cost of healthcare in Kerala?
Okay.
Is it truly affordable for everyone?
That's a crucial question.
Right.
And the answer is, it's complicated.
Yeah.
Despite this strong public health infrastructure, over 70% of healthcare expenditure in Kerala is out of pocket.
Wait, really?
Yeah.
That's surprising.
Yeah. You'd think with such a robust public system, out-of-pocket expenses would be lower.
You would, wouldn't you?
Yeah.
But it highlights the complexities of healthcare financing.
Right.
Even with free or subsidized services at government facilities.
Right.
There are costs associated with medications, diagnostics, and other ancillary services.
Okay.
And that's where the private sector comes into play.
So even with this amazing public system, there's still a significant reliance on private healthcare.
Right.
Why is that?
Well, there are a few reasons.
Okay.
Private hospitals often offer more specialized treatments.
Okay.
And sometimes people perceive the quality of care to be higher.
Yeah.
Plus, with this rising burden of lifestyle diseases, many people need specialized care that may not be readily available or accessible in the public system.
So it creates a bit of a two-tiered system.
You got it.
Those who can afford private care opt for it,
Right.
while others rely on the public system, which may have longer wait times or limited access to specialized treatments.
Oh, got it.
And this disparity in access and affordability is something the government is actively trying to address.
Yes.
One way they're doing this is through public-private partnerships.
Yes.
Or PPPs.
That's it?
Yes. PPPs. They're mentioned quite a bit in these articles.
Oh.
Can you give us an example of how they're working in Kerala?
Absolutely.
Okay.
The Karunya Benevolent Fund is a prime example.
Okay.
It's a government scheme that partners with private hospitals to provide financial aid for critical illnesses like cancer and kidney diseases.
So it's like they're leveraging the strengths of both sectors.
Yeah.
The public sector's reach and the private sector's expertise to make these life-saving treatments more accessible.
Exactly. It's a way of bridging the gap and ensuring that those who can't afford private care aren't left behind.
Okay.
But it's not a perfect solution.
Right.
It still relies on the private sector's willingness to participate.
Right.
And there are concerns about cost control and ensuring quality of care.
It sounds like a constant balancing act.
It is.
Trying to ensure both access and affordability.
Yeah.
It makes you wonder, what other innovative approaches are they exploring?
Well, that's where things get really interesting.
Ooh.
And that's something we can delve into in the next part of our deep dive.
Okay, everyone, stay tuned. We'll be right back after a quick break to continue exploring the fascinating world of Kerala's healthcare system. We'll dive deeper into these innovative approaches and discuss how they're trying to bridge the gap between public and private healthcare.
Sounds good.
Welcome back to the deep dive. We're in the middle of exploring Kerala's healthcare system, a model that's achieving some pretty remarkable things.
And grappling with some pretty complex challenges as well.
That's right. Before the break, we were talking about these public-private partnerships, or PPPs, and how they're trying to bridge the affordability gap.
Yeah.
It's like they're trying to find a middle ground between a purely public system and a completely private one.
Exactly. And it's not just about financing.
Okay.
It's also about leveraging the expertise and infrastructure of both sectors. For instance, they're using PPPs for ambulance services, diagnostics, and even telemedicine.
It's fascinating how they're weaving together these different elements. It's not a one-size-fits-all approach.
Not at all.
Oh.
And this adaptability extends to their approach to healthcare governance.
Okay.
One thing that really struck me while going through these articles is their commitment to decentralized planning.
Decentralized planning. That sounds interesting. Can you elaborate on that?
Sure. They have this initiative called the People's Campaign for Decentralized Planning, which essentially empowers local communities to be actively involved in healthcare decisions.
So it's not just top-down directives from the state government?
Not at all. It's about bringing decision-making closer to the people, allowing for more localized and context-specific solutions.
That makes a lot of sense. Healthcare needs can vary drastically between urban and rural areas, even within a small state like Kerala.
Precisely. And this bottom-up approach has been particularly effective in addressing the unique challenges faced by rural communities.
It's like they're recognizing that a one-size-fits-all approach simply won't work in a diverse region like Kerala.
And this localized approach extends to their public health initiatives as well.
Okay.
You know, we were talking earlier about their success in controlling communicable diseases.
Right.
Well, a lot of that success can be attributed to their targeted interventions tailored to the specific needs of different communities.
So it's about understanding the nuances of each region and crafting solutions that fit rather than imposing a blanket policy.
Precisely. And this nuanced approach requires a deep understanding of the local context, which is where community involvement becomes so crucial.
It's like they're recognizing the power of local knowledge and incorporating it into their healthcare strategy.
Exactly. And it's not just about community involvement.
Right.
The government's commitment to public health is also reflected in their budget allocation.
They're putting their money where their mouth is.
Absolutely.
Yeah.
They've consistently prioritized healthcare spending, allocating a significant portion of their budget to the health sector.
Yeah.
And it's not just about the amount of money, but how they're spending it.
I imagine with all these initiatives, the Urdhva mission, the focus on decentralized planning, they must be making significant investments.
They are, but they're also being strategic. They're investing heavily in primary healthcare and preventive care,
Right.
which, as we discussed earlier, has proven to be highly effective.
It's like they're playing the long game, recognizing that a healthy population is ultimately more cost-effective than a system that's constantly reacting to illnesses.
And this focus on prevention is not just about cost savings.
Right.
It's also about improving overall health outcomes and quality of life for the people of Kerala.
It's a holistic approach, recognizing that healthcare is not just about treating diseases, but about creating a healthier society.
Precisely. And this holistic vision extends to their efforts in regulating the private healthcare sector.
Yes. We were talking about the rising dominance of private hospitals and the challenges of affordability.
Right.
What's the government's role in all of this?
Well, they're walking a tightrope.
Yeah.
On one hand, they want to encourage private investment in healthcare to expand access to specialized services.
Right.
On the other hand, they need to ensure that essential healthcare services remain accessible and affordable, even in private hospitals.
So it's about finding that balance between fostering innovation and protecting the interests of the public.
Exactly. And it's an ongoing process, constantly adapting to the changing dynamics of the healthcare market.
Okay.
They're exploring various regulatory mechanisms, from price caps on essential medicines to setting standards for quality of care in private hospitals.
It sounds like they're trying to create a level playing field, ensuring that the pursuit of profit doesn't come at the expense of public health.
That's the goal. But it's a complex issue with no easy answers.
That's
Right. The private sector plays a significant role in Kerala's healthcare landscape.
Right.
And striking that balance between regulation and encouragement is crucial.
It makes you wonder if there's a perfect solution. It seems like every approach comes with its own set of trade-offs.
That's true. And it's not just about regulating the private sector.
Okay.
The government also needs to ensure the sustainability of the public system, especially with the rising costs of healthcare.
That brings us back to the financial side of things. How are they managing to fund all these initiatives?
Well, they're exploring various avenues.
Yeah.
Increasing tax revenue is one option.
Right.
But that's always a politically sensitive issue.
Yeah.
They're also looking at attracting foreign investment in the healthcare sector.
Foreign investment. That's interesting. Is there a risk that this could lead to further privatization of the system?
There's always that risk, but it's a balancing act. They need to find ways to inject capital into the system without compromising their core values of equity and accessibility.
It sounds like a constant juggling act, trying to balance competing priorities and ensure that everyone benefits from the system.
It is. And it's not just about money.
Right.
It's also about human resources.
Yeah.
We talked earlier about the shortage of healthcare professionals in rural areas.
Right.
They're exploring various ways to address that.
Yeah.
From offering financial incentives to improving living conditions in rural areas.
It's about making rural postings more attractive to doctors and nurses.
Exactly. And it's not just about attracting talent, but also about retaining it. They're investing in training and professional development programs to ensure that healthcare workers have the skills and knowledge to meet the evolving needs of the population.
It's a long-term investment in building a sustainable healthcare workforce.
Exactly.
Yeah.
And this long-term vision extends to their approach to technology as well.
Yes, technology. We touched upon that briefly. How are they leveraging technology to improve healthcare delivery?
Well, they're exploring various avenues. Telemedicine is one area where they're making significant strides. Using technology to connect patients in remote areas with specialists in urban centers is a game changer.
It's like bridging the geographical gap through technology.
Precisely. And it's not just about teleconsultations. They're also using technology for remote monitoring of patients, especially those with chronic conditions.
So they can track their progress and intervene early if there are any issues.
Exactly. And it's not just about improving access to care. They're also exploring how technology can be used to improve efficiency and reduce costs.
For example?
Well, they're experimenting with electronic health records.
Okay.
Which can streamline the flow of information between different healthcare providers.
That makes a lot of sense. It can reduce duplication of tests and ensure that everyone involved in a patient's care is on the same page.
Precisely. And it's not just about administrative efficiency. They're also looking at using technology for things like disease surveillance and early warning systems.
That's crucial, especially with the threat of emerging infectious diseases.
Absolutely. Yeah. By using technology to track and analyze health data, they can identify potential outbreaks early on and take steps to contain them.
It's like they're building a smarter, more responsive healthcare system.
That's a great way to put it. And this focus on technology is not just about adopting the latest gadgets. It's about using technology to address the specific challenges faced by Kerala's healthcare system.
So it's not a one-size-fits-all approach to technology adoption.
Not at all. It's about carefully selecting and implementing technologies that align with their goals of equity, affordability, and accessibility.
It's a fascinating example of how technology can be used to enhance rather than replace the human element of healthcare.
Exactly. And this focus on the human element extends to their efforts in engaging with the public.
We haven't talked much about public perception. How do the people of Kerala view their healthcare system?
That's a great question. And the answer is, from what I've gathered, they view it quite favorably. There's a strong sense of trust and confidence in the system.
So they feel like the system is there for them.
Yes. And that's crucial. They see the government as a partner in their health journey. This trust has been built over decades through consistent investment in public health and a genuine commitment to serving the needs of the people.
It's not something that happens overnight.
Not at all. It takes years of consistent effort and a genuine commitment to putting people first.
And this trust is reflected in their high levels of health literacy and awareness.
Absolutely. They're actively engaged in their own health and well-being. They understand the importance of preventive care. They participate in health screenings, and they're not afraid to ask questions and seek information.
It's like they're empowered to take control of their own health.
Exactly.
Yeah.
And this empowerment is a key factor in Kerala's healthcare success story.
It's a reminder that healthcare is not just about systems and structures, but about people.
Absolutely. And it's this people-centric approach that makes the Kerala model so inspiring.
Well, it certainly is a model worth studying and learning from. But as we wrap up this part of our deep dive, there's one question that looms large. What does the future hold for the Kerala model? Can they sustain these achievements in the face of rising costs, an aging population, and evolving health challenges?
That's what we'll explore in the final part of our deep dive.
Stay with us, listeners. We'll be right back after a quick break to delve into the future of healthcare in Kerala.
And we are back for the final part of our deep dive into Kerala's healthcare system.
Yeah.
We've explored their successes, their challenges, some innovative approaches they're taking.
It's been quite a journey.
It has been.
Yeah.
And now the big question, what's next for this model that's captured global attention? What does the future hold?
Yeah. What does the future hold for the Kerala model?
Can they keep this up?
Well, like any healthcare system,
Right.
Kerala is facing a future full of unknowns.
Yeah.
The key will be their ability to adapt and stay ahead of the curve.
So what are the big things they need to focus on? Where do they go from here?
One thing we can't ignore is the rising cost of healthcare.
Right.
Even with a strong public system.
Right.
Those out-of-pocket expenses hit people hard.
Yeah.
They need to find ways to keep costs down without sacrificing quality.
It's a tough balancing act. What kind of solutions are they looking at?
They're considering a few things.
Yeah.
Strengthening regulations for private hospitals.
Okay.
Promoting generic medicines, and even exploring new types of insurance schemes.
Okay.
All to make healthcare more affordable. Plus, using technology wisely, like telemedicine and remote monitoring, could make a big difference.
Technology seems to be a recurring theme in Kerala's strategy. It's like they're embracing the digital side of healthcare.
Exactly. They're also looking into how they can use big data and artificial intelligence. Imagine being able to predict diseases, better personalized treatments, and use resources more efficiently. That's what they're aiming for. It sounds like they're really thinking ahead, but we can't forget about the human side of healthcare.
Right.
We talked about that shortage of healthcare workers.
Yeah.
In rural areas. How are they planning to fix that?
That's a critical issue.
Yeah.
They need to make rural postings more appealing.
Yeah.
Better infrastructure housing opportunities for professional growth.
Right.
They're also looking at telemedicine and mobile health units to bridge the gap and bring specialists to those areas.
So it's like a multi-pronged approach.
It is.
We also need to talk about that aging population and the rise in those chronic diseases.
Right.
What are they doing about that?
Kerala needs more geriatric care facilities.
Okay.
Better palliative care services and programs that promote healthy aging.
Okay.
Plus, they've got to double down on preventative measures and lifestyle changes to tackle those lifestyle diseases head on.
So from building new facilities to launching public health campaigns?
That's it. It's about creating a system that can handle the changing needs of their population.
This all sounds promising, but let's be real. No system is perfect.
Right.
What are some roadblocks Kerala might run into as they aim for healthcare excellence?
One challenge is keeping that balance
Yeah.
between the public and private sectors.
Okay.
They want equitable access to quality care,
Right.
but they also need private investment.
Yeah.
It takes careful planning and regulation to make that work.
It's about working together, not competing against each other.
Precisely. Another challenge is keeping up with all the rapid advancements in technology. Embracing those new tools while protecting privacy, cybersecurity, and ethical considerations.
Right.
That's not easy.
It's about using technology responsibly and making sure it benefits everyone.
You got it. And finally, there's the never-ending challenge of sustainable funding for healthcare.
Right.
Allocating resources wisely, using funds efficiently, and exploring new financing models. That's all crucial for the long-term health of the system.
It's a constant process of adapting and finding new solutions.
Absolutely.
Yeah.
But when you look at Kerala's journey so far, it's clear they're up for the challenge. They're willing to innovate, learn, and keep pushing forward.
And what about the rest of the world? What can other healthcare systems learn from Kerala's experience?
Kerala shows us that you don't have to spend the most money to get good health outcomes. Smart investments, prioritizing primary and preventive care, empowering communities. Those are the keys. And you've got to be ready to adapt to new challenges.
It's about putting people at the center of the healthcare system.
Exactly. And that's a valuable lesson for any healthcare system, no matter where you are in the world.
So for you, dear listener, we hope this deep dive into Kerala's healthcare model has given you a fresh perspective on what's possible.
It's a story that's still unfolding.
Right.
And it's inspiring to see their commitment to building a healthier future for everyone.
Keep those sources coming, and we'll keep diving deep with you. Until next time.